reticular activating system, that's pretty much what allows you to filter out everything that you don't want to look at and zone in on what you want to focus on. That's the main thing that it does. So if for some reason the RAS is not functioning, you're gonna act loopy. You might act a little drunk, and you won't really know what's going on because everything is kind of impaired because you're not able to filter out everything else and focus on anything, which is what makes you kind of act drunk sometimes. So let's see what the second PowerPoint says. The RAS is responsible for functions of staying awake, paying attention, and sleeping. So yeah, it keeps person alert and oriented. So when we're talking about patients being mentally altered, this system right here is one of the major ones that's being affected, and it's in your brain, obviously. So it's a system in your brain that's being affected whenever your patient is mentally altered. That is the issue. So as far as requirements for the brain tissue of the RAS to function, it's like everything else. It's like every other cell in the body. We need oxygen, we need glucose to make ATP inside the cells of the brain tissue to keep the brain functioning. It's as simple as that. Of course, water to keep the brain moist and hydrated. Now, the only difference with the brain, though, is that the brain is highly sensitive, and just like the heart. So if the tissue dies and any part of the brain dies, that tissue is dead. It's no longer going to come back, just like the heart. And the brain is essentially what makes you human. Allows you to function and be who you are. So if we deprive the brain of too much oxygen or glucose after being mentally altered, brain tissue starts to decay, and there will be some irreversible causes that happen. All right, so causes of altered mental status. So we kind of just hit on that. So if the RAS is not getting oxygen and glucose, obviously it's not going to be fed the ATP that it needs to function how it should function. So you're not going to be functioning optimally. So then you get mentally altered. So, but what can make that happen? So obviously trauma directly to the brain would be an obvious one. So if your patient gets hit with the baseball bat on their head, and that the force from that baseball bat was significant enough to crack the skull. Now, if that happens, blood is going to start pooling inside the cranium, right? And the cranium is where your brain lies. Well, if blood continues to pool in the cranium, and we all know that the cranium is a confined space, meaning that there's nowhere to budge. So the blood that is pooling in the brain is going to start compressing down on the brain itself. So that's going to not only cause physical damage, but it's also going to compress the vessels that feed the brain itself. And now the vessels are compressed, blood can't get to the tissues of the brain to feed it with oxygen and glucose. Okay, so that's how trauma does that. Infection is this. As far as infection, I'm thinking sepsis is the biggest issue with your mentally altered patients. So if your patient has sepsis, and we all know sepsis can also cause septic shock, and what that is essentially you have waste in your vessels. Your body is, for some reason, well, it could be one of two things. It could be a localized infection that spread out and got in through your system, your vascular system, and spread through your entire body. That's one way. That's one way of getting septic in the body. The other way of getting septic is your patients that have kidney failure, for example. They can't filter the toxins out. They build up in the body, and that can actually cause damage to your brain as well. Chemical toxins that are harmful to brain tissue, obviously, too. So any chemicals that the body intakes that can cause damage to the brain. So primary brain problem, stroke. So I know I've used this comparison before, but David, a stroke is to the brain like what is to the heart?
Heart attack.
A heart attack. And why is that? what's a stroke that makes it similar to a heart attack?
Give me a moment. Let me think.
Yeah, I got you. So a heart attack, what's going on with the heart attack? It's a blockage of some sort, right?
Right, it's a blockage. It's not getting.
So if there's a blockage in the coronary arteries, what's going to happen? What's not going to get to where it needs to go on time?
Oxygen.
Blood, right? Blood.
Ah.
So yeah, blood. So oxygen can't get there. So obviously, if blood's not getting to a part of the heart because there's a blockage, also oxygen and glucose can't get there because the blood's not getting there. It's carried in the blood. Well, a stroke is that exact same issue, but except it's in the brain now. So there's a blockage in a vessel in the brain, and essentially it's a heart attack. So a stroke and a heart attack are the exact same thing. It's just happening in different locations. A stroke is referred to the brain. A heart attack is the heart, obviously. But it's the exact same issue, just different locations. So obviously, if we have a blockage, a stroke is a blockage in a vessel in the brain, then what does blood carry? It carries oxygen and glucose. So that's not going to get to where it needs to go. Therefore, ATP can't be made, and the tissue starts to be deprived and eventually will die if it continues, if it keeps on being deprived of oxygen and glucose. All right, problem within another system, hypoxemia due to asthma. So if they have a respiratory issue, obviously O2 is not going to come in, and your brain will not get enough oxygen. So that's another example. Any questions so far about anything? Okay.
Wait, sorry. You said hypoxemia?
Oh, hypoxia. I'm sorry. Hypoxia.
Oh, okay. I just want to make sure.
Yeah. Assessing the patient with altered mental status. Let me see. Assessing patient. So yeah, so patients that are mentally altered, obviously they can pose a threat to EMTs and cops alike, because when your patient is mentally altered, their RAS is not functioning right. So they really don't understand what's going on, and because they don't understand what's going on, they might be confused, and if they're confused, they're going to be anxious and possibly even angry because of the confusion. So they will present as being drunk sometimes, and in not a lot of cases, but in some cases, they will be combative. They will literally act like they're drunk. So just watch out for that. So you always consider safety of yourself, obviously, and your team. So I've always talked about this, and I always bring it up, and it's like, at least for the NREMT, as far as safety goes, you're number one. Your safety comes before anybody else's. Your partner is number two, and then your patient. Because if you both aren't safe and healthy, there's no way you can help that patient or any other patient. So you come first, your partner comes second, and patient comes third. Okay, and that's when talking about safety. Use law enforcement when necessary. So sometimes you when patients not just mentally altered, but when they're acting up and they're not complying and they seem like they could be dangerous to you or anybody else around, you will call law enforcement. In a lot of cases, if it's like an assault because somebody was mentally altered for whether it's a narcotic, alcohol, or just because of hypoxia or low glucose, cops will be there and before you, and usually will always have the patient or the suspect, whatever they think it is, kind of detained for you, and then you come in, you see if they're drunk or if it's a low glucose thing or what the issue could be.
So sometimes wouldn't they just if you get the call at first, wouldn't law enforcement like put it in through like ECC and kind of like stage you before you get to the scene to like, you know, like to make sure the scene's safe? Don't they stage sometimes the medics before they get to scene?
Yeah, they will. If it's serious, they'll stage you. Now it just depends on like if it's just a dispute and nothing really crazy is going on. Like it's not a there wasn't an assault with a weapon, or it's not a domestic abuse. If it's not one of those, if it's just like a typical dispute or someone arguing or acting differently, you'll end up just going there, and the cops will get there when they get there. And then if you get there and it is dangerous, absolutely you have to leave, call it in, and then stage yourself and wait for the cops to come. But if it's a serious case, when someone's already assaulted, in that situation, then dispatch will tell you to stage a block away or 2 blocks away until police arrive, and then they'll give you the green light to go in. Yeah. So you're
Okay.
right. Yeah. Okay, so let's see, patient alter status. See, loss of consciousness with syncope. So in case you don't know this, please write this down, because you are going to see this word syncope a lot. Syncope just means they passed out. They're unconscious. So if you don't know that, please write that down right now. You're going to see it again and again and again. Usually brief, the patient usually regains consciousness very soon. Okay. See, primary assessment. So your primary assessment, obviously, in your primary assessment, you're looking for visuals, obvious things. We're not getting into any details. We're seeing if the patient is breathing okay, adequately, or are they working to breathe? How do they physically look? Do they look pale and tired, or are they, okay? So hypoxia is one of the most common causes of altered mental status. Always consider the possibility of any airway or breathing problems. See, there's not much that I can say to this. We talked about asthma. We talked about anaphylaxis. I think we still have to go over anaphylaxis more. I think that's the next chapter, actually. But we talked about asthma. So we know how asthma prevents oxygen from coming into the body adequately. So obviously, if oxygen is not coming in, then that oxygen can't get to the brain, and the brain is being deprived of what it needs to work adequately. So the patient is going to be mentally altered. So that's what that means. And yeah, the second bullet, always consider the possibility of an airway or breathing problem. When it comes to your adult patients, obviously you're always gonna know, you're gonna have an idea of what's going on, unless you just came up in an alley where a patient just wasn't conscious and somebody found him. But besides that, you're always gonna know what happened. They'll tell you if it was an airway issue. The biggest the biggest thing with this is your pediatrics. So with your pediatrics that can't really talk, that's when you have to be more careful. Look in the airway, look for that nasal flaring, look for hints that can tell you that maybe it is an airway obstruction, but for some reason it's not that noticeable. Here, children may not be able to answer a question. So we talked about this already right now. Let's see, okay, so this is good, yeah, actually. So if you come up to a patient and you think that they are acting different or kind of loopy, not so much for adults, but for children, it is good to ask the parents if it's their baseline, if the way they're acting. I wouldn't ask it like that, obviously, but I would ask, is this normal for your child to act this way? Is this normal behavior? And then just go off of that. See, ask parents or caregivers, are they acting differently than normal? So for diabetes, see, glucose and digestive system. So we know that glucose is a fancy word for sugar in the body. So glucose and oxygen make ATP. Right now we're in review mode, obviously. And body's basic source of energy. This is a definition that I would also write down, because I can see this somehow, some way coming up in a question on the NREMT. So glucose is the body's basic source of energy. That's a pretty good definition, and I would get that down somewhere. Body cells require glucose to remain alive and create energy. We talked about that. So glucose can't just go inside the cells by themselves. They just can't go through the little membrane of the cell. They need insulin. And we talked about insulin before too. So the way that I describe insulin is that insulin is like the doorman of a cell. So the cell is like a hotel, right? The cell itself is like a big hotel, and insulin is the doorman of that hotel, and glucose is a guest that's trying to get in. Insulin opens the door of that fancy hotel for Mr. Glucose to walk in, all right? So other people also compare it to like a key and a doorknob, but that never stuck with me, so I came up with this other way. I got it from somewhere, I don't know, but here you go. So insulin itself is a hormone. So The insulin is created by the pancreas. What happens is that blood that travels through your pancreas, as it travels through your pancreas, the levels of glucose are monitored. Now, if levels of glucose start to go increase higher than normal levels, what's going to happen is that the pancreas is going to give out insulin. It's going to pour insulin out into your bloodstream to bring down the levels in your bloodstream to normal, and also to feed the brain. I mean, not just the brain, but every single part, every tissue in your body, and your brain obviously being one of them. Any questions so far? All right. Let's see. Okay. So that's how that works. So insulin and blood sugar combine to enter the cell. So insulin and the pancreas produced in the by the pancreas. We talked about that, and like I said, I didn't say this, but it binds to receptors sites on cells. So insulin acts like a doorman for glucose to be able to enter the cell itself. Without insulin, glucose cannot just go in the cell. So it's a very important part of the energy production process. So allows large glucose molecules to pass into cells. Sugar intake, insulin production balance allows body to use glucose effectively. Talked about that as well. So there are two types of diabetes. There's type 1 diabetes and type 2 diabetes. Type 1 diabetes, usually these patients are born with it. It's something that's genetic. And what happens is that, like it says here, the pancreatic cells do not function properly. So insulin is not made, or not enough insulin is made. So what happens is that if not enough insulin hormones are made, then not enough glucose is going to get into the cells to make enough energy to keep the patient alive. So that's the issue with these patients. And because of that, they have to take insulin to make up for the decrease in production. So because obviously the pancreas isn't making enough insulin, so you have to take insulin to just make up for that. You have to add in, it's like you have to add insulin into your system from outside to make up for that. Not enough insulin to transfer synthetic insulin typically is prescribed. These patients, type 1 diabetic patients, like I said, they're born with it. It's genetic. So a lot of your younger diabetic patients will come up with type 1. But you will also see some that are type 2, obviously, nowadays. So type 2 diabetes, this is usually because of a bad diet. So if the diet is regulated, they can actually fix this or reverse it.